Lahore. She is the editor-in-chief of Pakistan Biomedical Journal, editor of Asian Journal of Allied Health Sciences, and editor of Pakistan Journal of Physical Therapy.
This wonderful event, and due to shortage of time, I will just give a short overview. I will discuss only the immunogenicity in regenerative medicine, and I will not discuss stem cell therapy or regenerative medicine, and I will just discuss the challenges and the role of substance P and neurokinin 1 receptor in regenerative medicine. Whether it is embryonic stem cell or induced pluripotent stem cells, the challenges that lies in the regenerative medicine, these are the tumor formation and immune rejection. So these are the main challenges, and also in IPCs, there is epigenetic and genetic anomalies and such issues. And so the challenges are to understand the mechanism underlying the immunogenicity, and cancer concern poses a serious bottleneck of developing individualized cell therapy using patients' own IPCs. And the co-stimulatory receptor blocking agents. These are the new techniques, and according to the recently published literature, these blocking agents are they have very promising results, and the co-stimulatory receptor blocking agents specifically block an interaction between immune cell called a T cell and the transplanted stem cells. And in this diagram you can see that according to one study, the embryonic stem cells were injected genetically in the genetically engineered mouse, in the leg of the mouse into the leg of the mouse of different genetic background, and it was monitored, and the cell's fate was monitored by bioluminescent imaging, and it was found that the untreated mouse, it was rejected within 21 days, and the cells and the mice who were treated with traditional immunosuppressants, the cells survived for 28 days, and in the treated mouse with the blocking agents, the cells survived more than 100 days. So these are the new techniques, and according to which the immunogenicity can be improved, immune rejection can be coped, and also according to this concept, I have proposed the neurokinin 1 receptor antagonist for this purpose, and SP, it is actually the receptor of the substance P, and the substance P, it binds to the NK1R, which is the neurokinin 1 receptor, and when SP binds to the NK1R, then the inflammatory responses are initiated. And what is substance P? It is a neuropeptide, and SP and NK1R are widespread. They have widespread distribution in both the central and peripheral nervous system, and they are located in all the body fluids. And recently they have been also found in the stem cells. And previously it is well established that substance P has a role in inflammation, in injury, and also in the repair and angiogenesis. And these are my own studies and the previous studies, and according to which we have studied the role of substance P in different pathologies, including COVID-19 as well as different cancers. And so this is the mechanism of action, that substance P binds with the NK1R and then initiates a cytokine storming, and it causes a decrease in nucleopentopeptidase, ACE2, and increase in sodium, potassium, calcium, and increase in CRP and ICAM1, and it leads to infection and pathologies. So this is also a drug, this is known as drug repurposing, when we use already FDA approved drug which is used for a different symptoms, we are using it for another one. So this is known as drug repurposing. And previously I have studied this substance P in different, for example, this is in 2011, I published this study from University of Milan, Italy, and it was on sudden infant death syndrome and sudden perinatal death. And I reported the expression of this neurotransmitter in stillbirth, sudden death, and its alteration in the cardiorespiratory control. And this is another study, and this is also, this was published in 2017, and I studied the role of substance P and NK1R in the trigeminal system and its association with the sudden perinatal death. And this TAC1 is the gene of the substance P, and this study was also published in 2014, and it is also, it is a computational study which, and according to this study, the substance P, and it can be involved in different pathologies, and which was later proved in the future studies. And we also studied the substance P in COVID infection, and we did a clinical trial as well, which was very successful and showed very promising results. And so this was, according to the results, it was involved in the inflammation, and when it was, when the patient was treated with the combination of the drugs, neurokinin 1 receptor antagonist, and along with the dexamethasone, and the patient was recovered in 3 to 5 days. So these are the results, and I will not go into the detail. And this was the paper which was published in 2021, and in which I proposed NK1R receptor in, for the treatment of COVID-19. And there are certain other papers on brain tumor and pain severity and breast carcinoma, oral carcinoma, and which also suggested the role of substance P in cancers, in inflammation, as a prognostic and diagnostic marker in different pathologies. And it is also, it was published, this paper was also published in 2021, and it is, and it also provides a neuropathological explanation of the involvement of substance P in COVID-19, and gives an explanation that why there is minimal severity and comorbidity, minimal severity in and complications of COVID-19 infection in the children. And this is another theory according to SP and NK1R. And this clinical trial was conducted under the supervision of Professor Javed Akram and Professor Dr. Faridoon Jawad Ahmed, and it was included in the WHO guidelines of 2020. The preliminary finding urges further research into the magical peptide, which can be used as a treatment strategy for various diseases by maintaining an optimal balance and regulation. And we can see future of treatments into peptides, and peptide researches should be investigated on priority basis. The successful development of safe and effective immune tolerance strategy will greatly facilitate the clinical development of human pluripotent stem cell based therapy, and future effort will be devoted to establish genetically stable iPSC cell bank and cell line with the best match to the patient's HLA, which will be used for the cell therapy. And this is the historical timeline, and according to this, the substance P was discovered in 1931, and after that several researches were conducted. But the first, from Pakistan, we reported for the first time its role in respiratory disorders, in COVID infection, and also different cancers and human biopsies. And the previous studies were published only on, they were conducted on cell lines, but not in human biopsies and viral infections. And for this work, we got appreciation from WHO and many other international organizations. And in the figure, in the upper figure, you can see he is the discoverer of the, on the right side is von Euler, and he discovered substance P in 1931, and along with With him is his team member, Professor Peter Ome, and from Germany. And he contacted me and for this research, and currently I am doing some projects with Professor Peter. And in the figure below you can see that we are signing an MOU. It is a signing ceremony between University of Lahore and UHS and Amgen Pharmaceutical Company, and for this work on substance P. And currently, like this study which was initiated from Pakistan, and it has now gained global acceptance and appreciation, and we are now like corresponding with WHO, as well as Elsevier has decided to publish a book on the substance P, and it will be the first book on substance P, which will be and also it will be used as a textbook in different international universities. And currently I am working on this book. And so this is all about Lahore Medical Research Center, and we have 7 research journals and on different medical and allied health and biotechnology, nursing, therapist, diet factor. These are journals of Lahore Medical Research Center, and we publish in various journals during 1 year. And these are our collaborators and partners, national universities and as well as international universities. And these are our memberships. We are member of all these organizations. And then at the end I would like to announce a new journal from the Forum of Society of Regenerative Medicine, and this is the Stem Cell Regenerative Medicine Journal of Society of Regenerative Medicine and Contemporary Clinical Practices. And you can all publish your research related to stem cell regenerative medicine, PRP, or any other like exosome and cellular therapies, and they can be published in this journal. And thank you so much. Thank you.